Okay, part 12, Medical Education, part 2. The Foundation Program is a 2-year training program which forms the bridge between university level study at medical school and specialist or general practice training. It consists of a series of placements, each lasting for um, 4 months, which allow the junior doctor, known as a trainee, to sample different specialties. For example, pediatrics, a year one trainee corresponds to pre-registration house officer, post and a year two training to senior house officer, post. Uh, each trainee has an educational supervisor who ensures that more senior doctors deliver training in different ways, including clinical and educational supervision. To progress, trainees have to demonstrate a range of clinical competencies, which are assessed through observation in their workplace. Okay, mm, people in medical education, tutor, demonstrator, lecturer, professor, or senior lecturer, professor, college tutor, clinical trainer, educational supervisor. Okay, tutor, an academic or in some cases a postgrad student who leads tutorials. Okay, demonstrator, in anatomy teaching, someone who demonstrates how to dissect. Demonstrators are often postgraduate students paying their way through medical school. Uh, Lecturer or senior lecturer. Uh, an academic with teaching and research responsibilities who uh, contributes to the teaching of a particular discipline. Okay, professor, a senior academic with teaching and research responsibilities for a particular discipline. Usually a leading uh, figure in their discipline, college tutor, a consultant responsible for delivering a college training program, clinical trainer, a consultant assigned no, assigned to a trainee who provides training during periods of direct clinical care, educational supervisor, a consultant who supervises a trainee's period of training. Okay, now medical qualifications. Um, Bachelor of Medical Science, a degree often taken after 3 years of medical studies by students who may wish to follow a career in medical research. Bachelor of Medicine, Bachelor of Surgery. Bachelor degrees are undergraduate degrees. This is in the first degree for UK doctors. Okay, Doctor of Medicine, Diploma of the Royal College of Obstetrics and Gynecology. member of the Royal College of Physicians, or member of the Royal College of Surgeons. Doctors become members by successfully completing the assessment procedures in their college. Okay, Fellow of the Royal College of the Surgeon of England. Um, Other colors are indicated by the letters which follow. For example, Edinburgh, Glasgow, or Ireland. How doctors become a fellow depends on their college. For the FRCS, further examinations must be passed. For other colleges, it is by nomination or work assessment. Okay, now, oh my gosh. Okay, now the exercise. Yes, the exercise. Here, 12.1. Complete the phrases with the verb front buts. Two phrases can be completed in two different ways. Look at A and B opposite to help you. Assist, deliver, demonstrate, provide, supervise, take. Okay, one is demonstrate a competence or how to do something. Supervise a trainee by ensuring they successfully completes her training. Deliver a course or a training program as a teacher. Take a course or a training program as a student. As a student. As is progress or competence. Okay. Part 12.2. Match the two parts of the sentence. Look at A, B, and C opposite to help you. The number one is with the say. And FY1 is a doctor. Okay, number D, in the first year of the foundation program. A demonstrate part exercise 2. A demonstrator is an anatomy teacher with age say who teach dissection. Okay, number 3. A clinical trainer is a consultant with say who provides training during periods of direct clinical care. Okay, uh, the exercise 4. A supervisor is a consult with B say responsible for the training program of a trainee. Number 5. A medical school is with G. Okay, let me see. G. Part of a university responsible for medical education. Number 6. Say a placement is a period spent as a trainee in a hospital or in general practice. A college is a body of specialists responsible for delivering and assessing training in their specialty. Okay. A fellow is a specialist with who has reached the highest the highest level in their specialty. Okay. Write in full the qualifications of the doctors and surgeons. Look at C opposite to help you. Young husband, Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons of England, Fellow of the Royal, yeah, Dr. C. Doyle, Bachelor of Medical Science, Doctor of Medicine, member of the Royal College of Surgeons. Mrs. Inglis, Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons. Dr. Meriwether, um, Bachelor of Medicine, Doctor of Medicine, Fellow of the Royal College of the Physicians. Okay. Oh my God. Okay. The overseas doctors. Types of registration to manage and treat patients in the UK. All doctors must register with the General Medical Council. There are several types of registration. Provisional provisional registration is for doctors who have just qualified from medical school in the UK or from certain European Economic Area member states. Full registration is for doctors who have completed their year's clinical training. Limit registration is for international medical graduates who have not completed the equivalent of a year's clinical training in the UK. Specialist registration is for doctors who have completed specialist medical training and have a certificate of completion um, of training. The GP register is a register of all of those eligible to work in general practice in the NHS. Note, for full detail of the General Medical Council, see that's link. Um, PLAV before they can obtain full registration. Some categories of overseas doctors are required to take the Professional and Linguistic Assessment Board (PLAB) test. PLAB is designated to ensure those who pass can practice safely at the level of SHO in the first appointment in a UK hospital. Part 1 consists of a grading test of knowledge, uh, skill, and attitudes. Part 2 is an objective structured clinical examination. It consists of um, 16 5-minute clinical scenarios, now is statistics to ask professional skills. PLAB stage statisticians and advice. OSCEs assess desk skills. Okay. Yeah. Clinical examination, your ability to carry out a physical examination out of a simulate patient and actor trained to play this role will be as uncomfortable or intimate examinations will be carried out using a mannequin and an anatomical model. Practical skills you will be asked on practical skills such as soldering and giving intravenous injections, communication skill, your ability to interact with a simulated patient, or in some cases, the examiner will be asked. Skill tests may include breaking bad news and giving advice on lifestyles. History taking, your ability to take an accurate history and make a recent diagnosis will be asked. Advice on the stations from a successful um, candidate. 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 Read the instructions outside each station carefully. You have 1 minute for this. Don't forget the ABC Airways breathing circulation protocol in every emergency station. Don't forget that. It's very important. Keep in mind safety uh, precautions like drawing the sharps in the sharps bin. Check the patient to understand what is happening, then ask them about any concerns they may have. Don't just give a lecture. Listen carefully to what the actors say. No, sharps are needles and blades which must be disposed of safely in a special container called a sharps bin. Okay, the exercise. What kind of registration might these doctors obtain? Look at A opposite to help you. A newly qualified Spanish doctor provisional registration. A newly qualified Nigerian doctor limit registration. Sorry, a doctor who has successfully completed the first foundation year for registration. And an SHO who has successfully completed the foundation program and gained a um, certificate of completion of training after several specialist register past specialist registration. Write the abbreviations in words. Look at A, B, and C opposite to help you. Any doctors who wants to work in the UK must be registered with the C with the GMC General Medical Council. Some overseas doctors must pass the professional linguistic assessment test before they can register. Part 2 of the test consists of an objective structured clinical examination. In any emergency, remember the ABC protocol. That means airways, breathing, circulation, yeah. Mhm. Before you can obtain specialist registration, you must have a certificate of completion of training. Oh my god, it's very large. It's very big. Okay. My name is Musa and I come from Yemen. I came to the UK about 2 years ago after graduating because Yemen is outside the EEA. I could only obtain limit registration with the General Medical Council. At first, it, w- it was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the um, Professional and Linguistic Assessment Board test to show that I could work safely in the UK. If I had to give some advice to other candidates, it will be that at concealing statisticians, stations. You shouldn't simply memorize a set of phrases. It is better to really think about what are you are saying to the actor and get it, the intonation right. After completing my year's clinical training, I was able to obtain full registration, but I found it difficult to get an um, SHO pausing my chosen specialty, pediatrics. As a hospital now have to demonstrate there isn't a suitable candidate from the EEA. Once I have completed my second foundation year, I shall obtain the certificate of completion of training, which will allow me to proceed to completion of training with the um, General Medical Council, an important step on the road to becoming a pediatric consultant. Okay, finish. Goodbye. Thank you.